Good afternoon, judges. My name is Najiba Nurisma. I'm from Faculty of Medicine, Universitas Indonesia. And today I would like to present my paper about home-based asynchronous exercise to enhance physical functions and also quality of life in systemic sclerosis patients, a systematic review, and also meta-analysis. Imagine you're living with the conditions that hardens your skin, limits your movement, and reduce your ability to enjoy life. This is what happened to patients with systemic sclerosis globally. It is an autoimmune disease that alters the vasculatures of the skin, leading to fibrosis. Two of the most affected joints are the MCP and also PIP joints that really affect their loss of functions in using the hands and furthermore deformities. Around 1.87 million people affected by this disease globally, with 90% of them experience a very significant limitations on their hand functions, thus affecting their quality of life. In reducing and also preventing the progressiveness of the disease, it really needed to have a rehabilitation program for each of the patients. One of them is from exercise to improve or preserve physical ability in affected joints. While supervised exercise programs have shown promise in reducing and sustaining physical functions, especially in that case, but it's also a lack of feasibility and also affordability in the patients, so that we propose an intervention such as the home-based asynchronous exercise that offer an affordable, flexible alternative, but their effectiveness is in systemic sclerosis patients has yet to be systematically reviewed. So in our study, we systematically review and done a meta-analysis with the evidence to determine whether these interventions, the home-based asynchronous exercise, can improve physical functions and also quality of life in systemic sclerosis patients. From the method, we use the guideline from the Nurisma with PICO framework from 4 databases such as the PubMed, Cochrane Library, Clinical Key, and also Sclerosis. The study conducted in September 2024 with the guideline of risks of bias from the Cochrane and also data analysis using the Review Manager 5.4. Here is the keywords, and there are inclusion criteria, which is the randomized controlled trial study, and also home-based asynchronous exercise interventions. We exclude study that uses supervised or specialized facility interventions and also available in full text. From the results, we include 8 studies in total with low to moderate risks of bias. Here is the study characteristic that we can found from here. We can see that there are variabilities of regions of the studies, durations, and also interventions. Some of them using exercise using a portable device, some of them using the exercise in a app-integrated exercise, and but we can see the same or the similar trend in outcome with the improvement in the physical functions, such as this short-form physical component score, the functional index of hands, and not just that, it also shows an improvement in the trend of quality of life, such as the health assessment questionnaires and also 6-minute walking test, which is representing for the general health status of the aged patients. Here is the continuations of the studies. Next, it is a meta-analysis from the short-form physical component score. We can see a significant result with p-value of 0.004 in the study, implementing that this interventions really create a significant result compared to the control groups. Next, we also have the hand grip strength category or variables that shows a significant result with p-value of 0.003 and low heterogeneity. We also do, even though the study is less than 10 study, we still do the public panel plot to see the publications bias of this analysis, which shows no evidence of a significant asymmetry showing a low publications of bias. Here for the health assessment questionnaires, even though it's not significant as before and with a higher number of heterogeneity, there are showing trends of quality of life improvement in the clinical assessments on the studies. Intervention group were compared to be statistically more significant than control or confessional supervised rehabilitations. And we also see a notable improvement in the range of motion, 6-minute walking test, and also reduced fatigue impact scales. 3 advantages that we can analyze from these interventions are the accessibility, reduced lacks of adherence that caused by geographical and also transportation aspects, visibility coming from the simple exercise programs that can be done anywhere at any time, implemented by a larger number of people or patients. Here, for the cost reductions, the systemic sclerosis patients undergone a long time deformity, so that lower economic burdens can be really helpful for them compared to the hospital and also complex organization settings. The strength of the studies is we are one of the first meta-analysis that analyze home-based asynchronous and also low heterogeneities coming from all RCT studies. Limitations, we found a really few amounts that is available currently, and this analysis didn't investigate the variabilities of the interventions or exercise that was given in the studies. To improve, maximize, and also see the sustained effect, we recommend to the future studies with larger sample size, extended intervention durations, and also standardized exercise protocols to confirm the long-term benefits and also can be implemented by a lot of patients globally. To conclude, there were several key benefits for hand function, physical performance, and also quality of life in these scleroderma patients after home-based exercise that were significantly demonstrated compared to the supervised or conventional exercise. We also want to emphasize that blended format and also group-based exercise or community-based could be integrated to achieve optimal efficacy, reducing the lack of adherence and also compliance among the patients. Here is the reference. We want to thank you, and hopefully this findings pave the way for innovative patient-centered care solutions that can transform the life of many systemic sclerosis patients that cannot access rehabilitations or proper care for them. Thank you so much.
Thank you for your presentation. Surely that this presentation inspires us all. Do you have any comments or any questions?
Can you explain more about the asynchronous exercise? What are the different types of this exercise from other exercise?
Thank you so much for the question, judges. For asynchronous and normal rehabilitation care, they usually conducted and supervised by a doctors or therapists that watch them directly for what they do in the exercise. But with asynchronous exercise, the one that the patients do exercise at home with a guideline from the doctors to do it at home, and also it is needed to be accompanied from the patient relative to watch them and also accompany them to do the exercise. So basically, asynchronous exercise is some exercise that is not watched directly by the patient, the doctors or the therapists.
The term is home-based exercise are the same as asynchronous, right?
For home-based.
But I saw that you also include the hand grip. The hand grip exercise is also the home-based exercise or not?
For the hand grip strength, it's actually a counted variables that was metric that was assessed by the researchers after they undergone several months of the asynchronous home exercise. So it's basically a hand grip exercise that was using a simple tool at home that the patients can access.
You found the advantage in physical function in by home-based exercise. How about the safety issues, the risk issues in home-based is different from the conventional?
For the risk issues, I think we can see it from 2 points of view, especially for the patients itself. At home, they can do it in the safe environment, especially the one that the exercise get done is a simple movement, but with a regular or higher frequency, so that the safety is pretty much low compared to like a very higher intensity exercise. It also being assessed and also fitted for the patients that are not actively move or not really do exercise in their daily living. So the risks and also the safety is pretty much good here, and also compared to the safety that they need to go through after they want to, for example, they want to do the hospital for rehabilitation, they might encounter another safety and risks like in this transportation aspects and so on and so forth.
Okay.
Any more questions for the judges? Thank you very much.